Welcome, everybody. Thank you so much for joining us for this very important discussion. This is another great NextHealth PHL event sponsored by Independence Blue Cross, and we're so happy to have with us here today, Madeline Bell. I am Queen Muse with NextHealth PHL, a digital contributor and editor there, and I'm going to be having a wonderful discussion with the CEO of Children's Hospital of Philadelphia. I want to give a minute for Madeline to introduce herself. Some of you here may know a bit about her, but I want to give you an opportunity to share some of the things maybe we haven't heard about you. Madeline?
Well, thank you. It's so nice to be here with all of you. I'm the president and CEO at Children's Hospital of Philadelphia, and I actually started my career at CHUP as a pediatric nurse many years ago, never thinking that I would have the job I have today, managing 20,000 people and a $3.2 billion a year organization. So I always say to people that don't limit yourself in your career. And I certainly tell everybody at CHOP that you can be a lot of things and stay at the same place. And that's an important part of my messaging. In addition to being at CHOP, I also am on the board of Comcast NBC Universal. It's been a lot of fun to learn about a completely different industry from healthcare. And I'm the chair of the board of the Federal Reserve Bank of Philadelphia, yet another industry. And so I'm very lucky that I get to see the world through 3 different organizations and 3 really different industries. In addition to me professionally, I have a very large family of 7 kids and grandchildren, and we just had the opportunity to gather as a whole family for the first time this past weekend. So it was a lot of fun, and there's 24 of us in our immediate family. So needless to say, I burn the candle at both ends often, but it brings a lot of joy in my life, having the opportunity to have this work at a great place and have a wonderful big family.
I love that so much, Madeline. And as the second oldest of 7 siblings, I can tell you having big family is a wonderful thing. Thank you for sharing so much of that information that maybe some of us didn't know, right? That we didn't see in the headlines. So 25 years at CHOP has it been, at least for you?
Yeah, I actually, I'm what we call at CHOP a boomerang. So I started my career in 1983 as a new nurse. And then I left and I went to the mainline health hospital system and I did home nursing and lots of different things. And I came back 25 years ago and as a leader. So I sort of went away and then learned administration and came back and then have been back for quite a long time. And in that time period, I was chief operating officer for 8 years and I've been CEO for 6 years.
Awesome, awesome. And I imagine in that time you've just seen a lot of change, right? Especially in this past year, right? All the industries you mentioned through the boards that you're serving on, and especially in your role at CHOP, just lots of change amid the pandemic. Just wondering if you could speak to some of the ways the pandemic changed the way CHOP cares for its children and its patients. The pandemic forced a lot of us to make some shifts. What were some of the shifts and changes that CHOP made amid the pandemic?
I think the biggest shift was to move from in-person care to telemedicine. And, you know, we had a situation where we maybe would do 200 telemedicine visits in a month. And at the peak of our telemedicine during the pandemic, we did 2,000 visits a day. And it was a really great learning experience, I think, for the patients and families, but also for our team to say, hey, we can do this and provide safe care. And now what we're doing is stepping back and say, okay, we did this, you know, in an emergent situation and we did it well. And how do we step back and build the infrastructure and be a little more thoughtful about how we do it? But I would say that was a really big shift in how we care for patients. And because so many patients travel nationally and internationally, it allowed us to keep in touch with our patients and make sure that we were monitoring their care because they weren't able to get on a plane and come to CHOP.
Yeah, yeah. So it sounds like somewhat CHOP was prepared, not necessarily for the pandemic. No one could have been prepared for that. But what were some of the programs or processes that you put in place before the pandemic that you think made you better prepared to get through this?
Well, we did put some of the infrastructure for digital health, but not even close, telemedicine to what we really needed. And so some of it we just did on the fly. The other thing that I had to say is that, I've spent decades of my career doing tabletop exercises to prepare for a pandemic. And we didn't even come close to simulating what really did end up happening, because I think what we really didn't understand is what did it do to child care systems, what did it do to the financial markets, all of the things that it touched that had an absolute impact on our patients. We didn't have a really good sense of where all of our supply chain limitations were, both at CHOP and as a country. And so we've learned so much from this real life situation and are now, adjusting the way we prepare for the future. So, in an industry where we've simulated pandemics for years, we still were caught a little flat-footed on this one, and had to put things in place. But it brought out the creativity and the innovation, which was quite exciting to see.
Yeah, that's exactly what I was going to say. We know that this change kind of made everyone reassess their processes and try to figure out ways to do things better. It also spurred a lot of innovation, right? Folks trying new things, new ways, particularly in the field of healthcare. So talk to me a little bit about breakthroughs, right? The pandemic has spurred us to be more innovative. What are some of the biggest innovations you've seen in pediatric medicine this year?
Well, just a couple of things that are pandemic related and maybe some that are not. So I thought what was really exciting is that our policy lab created a national a model of the spread of coronavirus that was picked up nationally, across the entire country and used by school systems and governments. And what I thought was really neat is everybody came together and lent something to that. So we actually have a physician who's a nephrologist, so they're a kidney doctor, and his expertise was, what does the climate do to kidney stones? And so we added him to the team because because he's got this expertise in climate and health, he was able to look at, how does the climate impact COVID-19 and the spread of COVID-19. So it was sort of like, a call to all interested parties. We have another physician whose research is around dogs smelling certain diseases. And so she worked with the vet school at Penn on a method to have dogs literally sniff out coronavirus. So it brought out some really exciting things, in that way. And for children who get MIS-C, the multi-system immune response that mirrors something that used to be called Kawasaki's disease. So a couple of weeks after coronavirus, they get really organ failure and really bad fevers. And we have a program called an immune dysregulation program. Basically, it says, like, how is the immune system reacting in a bad way to things that happen or exposures. And that team went right into high gear and are working on multiple studies across the country, and specifically at CHOP, and trying to better understand MIS-C and why it happens, how to treat it better. So those were just a couple, but I think we had 160 research studies funded just related to COVID-19. But what I really tried to keep people focused on is, yes, we're in the midst of a pandemic, but we can't forget what we mean to children generally. And so we continue to invest in cell and gene therapy. And something that I think is really exciting is the work that we're doing on both gene editing and gene replacement. And I think we've made a lot of progress in hematologic diseases, so diseases that impact the blood system, and lots of progress for sickle cell disease, so taking a good gene to replace the gene that's defective or editing that defective gene. And we're working on clinical trials with different companies in that area based on the research that's done at CHUP. So that's pretty exciting. We continue to do research on how we use cells and the immune system to fight cancer. And so this whole, umbrella of cell and gene therapy, we are just at the very early stages. Even though we've had some incredible breakthroughs at CHOP in very specific areas, there's still so much more to come in both of those areas.
Yeah, and that's one of the cores of what we cover here at NextHealth PHL is all the exciting work being done in gene and cell therapy in what we call Silicon Valley, which we know CHOP has been at the center of over the past couple of years with some really great breakthroughs. I want to continue on this topic of innovation. I've read quite a bit and talked quite a bit about frontier programs, something that you spearheaded. Could you tell us a little bit about what they are and why you originally launched these programs?
Yeah, the original reason that I launched the frontier programs is that for an innovation to get from research to actually the bedside, from research in an academic setting to the bedside, it takes decades. So think about it, your child has a disease. My job is to try to figure out, how to get the best cures and treatments for that disease using our innovation. And what better way to do it than to really invest in people's really incredible sort of out of the box ideas. And so the frontier programs are basically an internal accelerator, if you want to think of it that way, where we have a competitive process and doctors, at CHOP who are also scientists or researchers say, my best ideas that can be translated to the bedside are, these three things, but they've always been in their lab just working on those three things. What this does is give them a team of experts from our strategy team and money to help accelerate their ideas to get it to the bedside more quickly. And sometimes that acceleration would happen with partnerships in industry. In academic medicine, we can't be all things to all people. And although we've had some success in commercializing our science, that's not the core of what we do. And so working with partners in pharma and medical device companies to help get these ideas even more quickly to the bedside. So the frontier programs is a competitive process. We now have 20. And sometimes people have applied multiple times and they've iterated on their ideas and finally become a frontier program. And these are the programs that end up putting CHOP on the map internationally, where patients will fly around the world or fly by 6 other children's hospitals to get to CHOP for this unique innovation. And for us, it's really exciting because it allows our physicians to see patients from all over the world. And some of these diseases are so rare that there's only a few hundred or a few thousand that exist in a year. And so it's exciting to really be able to push those innovations out more quickly and around the globe.
Yeah, and it sounds like a great way to address some of these unmet needs, right? These diseases that affect smaller groups of people tend not to get the investment and the time needed toward treatment. So that's really exciting. I didn't know if you could share a couple examples of the Frontier Program ideas that have managed to become Frontier programs and why they were chosen.
Yeah, so early on, one of the frontier programs, goes back to the cell and gene therapy was CAR T cells. And we were the first to have a successful CAR T cell patient. Actually, Emily Whitehead, I just heard from her dad last week, and she's a young woman now and cancer-free still. And what we wanted to do in that case, that was our first frontier program, is be able to offer CAR T cells to many more children. So to accelerate their ability and expand their capacity to do that. I think the second frontier program is a really different shift. It is some children are born with a limitation in their rib cage to expand. And so basically what happens, their heart and lung cannot grow. And one of our doctors created a titanium rib that allowed their chest wall to expand over time. And that became a frontier program so that we could help him be able to perfect that and perfect the surgery so that more children from around the world could come for this unique surgery. And then there's another program that's really exciting, but it's kind of hard to explain. Some children have a problem with their lymphatic system. So we're all familiar with our blood circulatory system, but we all have a system of circulation of lymphatic fluid. And sometimes people say like, oh, my lymph nodes are swollen. But sometimes in children, especially those who have some kind of pediatric heart disease, their lymphatic system leaks. And it leaks into their organs and throughout their body, and they become very puffy. All their lymph fluid just goes into their tissue. And so we have a physician that figured out how to plug up these literally minuscule leaks think of a leaky hose. And he goes in and he plugs those up, and it's life-saving for those children. So these are really, as you sort of said, rare diseases. And I would think of, CHUP and other children's hospitals as really a beacon for any child who has a really rare disease. This is what we do. And we have researchers who are focused just on that disease. And, these are just some examples of how researchers have focused on a very specific disease, and we're helping them to get it to more children. And most of the time it's life-saving.
Yeah, yeah. And it sounds like one of the ways to measure success in these programs is the ability to scale or to provide this treatment to a larger number of patients. Just curious how you measure success in other ways in these programs. We know sometimes that these research projects will get an injection of support and funding in the beginning, and then it kind of trails off as the years go on, and we see maybe a really exciting treatment go by the wayside. How are you making sure that the frontier programs don't kind of die off or fall away?
Yeah, I think a couple things. One is sometimes our seed fundings helps them get commercial funding. Sometimes our seed funding helps them get grant funding from the government or from maybe a foundation. And so part of the support we give them is how do they make it, continue to scale it and make it sustainable. But another thing that we do that I think is exciting is put people from different frontier programs together. And I was interviewing and talking to two frontier programs, one that's focused on gene therapy for sickle cell, and one that's focused on, this one was on the CAR T cells, and one that was focused on the lymphatic system. And the two physicians that are leading those talk to each other. And the one physician who focuses on the lymphatic system said, I wonder if we could harvest T cells from the lymph system instead of the blood, and maybe that would be more effective. And then that is exactly what they did. So because two frontier programs got together, they're now working on a whole different area to continue to evolve it, but also to make it sustainable. And then the same thing, I was doing a podcast with two people that are working on two different approaches to sickle cell, curing sickle cell. And they had they're in different labs and they didn't spend time together, and they're both frontier programs. And they shared an Uber together on their way to the podcast and have now thought about a new way to collaborate on the curing, of sickle cell. So I also think a side benefit that we didn't think about, and that's what I think innovation is all about, is when you have people who are really uniquely innovative and creative and you put them together, really exciting things happen. And so I think it's another way of not just sustaining, but continuing to improve upon the ideas that we initially fund.
Yeah, yeah. That sounds really excited, the collaboration aspect of it all. Just wondering how you go about choosing these programs. I know it can be really difficult to decide when it's safe to bet on an idea, right? Because you're betting with dollars, right? And we still want to be prudent with the funding. So talk to me a little bit about your process of judging when a treatment is ready to become a part of a frontier program and how you go about turning folks down.
Yeah, I would say saying no is always so hard because I fall in love with every idea and I want to support it. And people are so earnest about their ideas, particularly physician scientists. But we do have a process. They fill out an application, and it's pretty rigorous. And basically, it makes sure that the science is really solid and has been proven, and their method for translating that to the bedside is solid and has been proven in a small way, and that they have a patient population that lends well to scaling this, and that they're unique either in the country or the world. So there's, without going through the entire application, that's sort of the types of things that the application asks about. And then they, apply, and they come and they present to a panel of mainly internal people, but some external, who are physician scientists and people with different backgrounds who ask a lot of questions. And some of them are just not quite ready, either on the scientific side, on the clinical side. They haven't defined, their patient population well enough or narrowed it appropriately. And so some of them are turned down, some of them, but everyone who's turned down is turned down with help. So you're turned down, you get somebody to help you reapply. And some people have reapplied a few times before they become a frontier program. But I think with any innovation and any, entrepreneur, saying no is also important. Like what you're not going to do shows that you're disciplined and that you really are differentiating the things that make you special. And so while it's hard to do, we do say no.
Yeah, yeah, must be tough. So I wanted to talk a little bit more about the coronavirus, right? And how some of the innovations that we've seen have kind of changed the way we've treated other things. The mRNA technology has been critical to developing vaccines for the coronavirus. Can you talk to me about where you see this technology going in terms of pediatric medicine and how it could be helpful?
Yeah, I think it's a really great question. And my tip is I call it messenger RNA because I find saying that
That
I get tripped
helps.
up on it. So my trick to tell everybody in the audience is messenger RNA makes it so much easier to say. Well, I feel like what's really exciting is that technology was developed next door to CHUP at Penn. And then at CHUP, we have the Vaccine Education Center with Dr. Paul Offit, who has been, in the media throughout the pandemic, and he's on the FDA advisory committee to approve the vaccines, and not just coronavirus, but all vaccines. And so with Penn and CHOP together, I feel like this is a really exciting opportunity for us to look at how we can use the messenger RNA technology to develop other vaccines, or to take vaccines that exist today with a different technology and use that technology to make them even more effective. So I think that's one way. We also have a researcher. A big part of what we do at CHOP is intervene and diagnose and intervene with the fetus. So when a baby is in utero, so we do in utero surgery, we do in utero procedures, and moms are referred to CHOP who have babies with known birth defects. And we have researchers who are focused on this messenger RNA technology, which we really didn't know much about before, but what are the ways to deliver some therapeutics to the fetus using this technology? So they're now looking at research and are there things that they can do with genetically linked childhood diseases or other diseases that are detected in the fetus. Women get blood tests at about 10, 11 weeks of gestation, and it gives a lot of information. How can we act on that information using the messenger RNA technology? Because it's such a great delivery tool to deliver the information that needs to, good information to sort of let our body fight something. And that's exactly what happened, for those of us who had the vaccine with that technology. I think we are just at the very beginning of understanding how this technology could really explode in delivering therapeutics. But for us, delivering therapeutics in utero is even more exciting.
Yeah, yeah. And I just wanted to talk a little bit about the differences between caring for children and adults. We do see that there are, total different approaches to how we treat certain diseases depending on how old you are, but also how sometimes care in one area can translate to the other. Could you talk a little bit about, how some of the breakthroughs in pediatric medicine are helping us understand how to treat humans and adults as a whole?
Yeah, I mean, when people talk about genetic diseases or genetic predispositions, all of that is hardwired in utero and, when a child is born. And so that sort of opens up a whole world of possibilities, even for what we traditionally see as adult diseases like Alzheimer's and other adult onset diseases. So understanding the genetics of the fetus or the child in early childhood can really be so instructive in understanding what this child's lifetime opportunity for disease is about. And intervening at an early stage could change the course of their health, which is really exciting. And we have researchers at CHUP that are working on diseases that are traditionally adult diseases, adult onset diseases, but they're, detected in childhood or in utero. And so I think that is, I think it's pretty interesting to understand that you really want to invest early in and doing, sort of what we're doing is detecting and treating early rather than wait until later. I mean, many adult diseases are, due to lifestyle, but also could be lifestyle combined with genetics. And so understanding that and intervening early is really important. It also, though, brings up some really challenging ethical dilemmas. If your child is detected to have something that might happen later in their life, how do you deliver that information to the parent, to the child? What does that mean for the course of their life? And so I think genetic counselors and ethicists will be working double time, and we'll probably need more of them in the future as we think about some of these things.
Yeah, yeah. And a perfect pivot to my next question, because I want to talk about the future at CHOP. I'm pretty sure you have a wide casting net of vision for what happens next at CHOP in terms of what you guys are going to focus on. Talk to me a little bit about some of your future vision or goals for CHOP as a whole, and what are some challenges you might have to overcome to get those things done?
Well, big picture, I would say my goal, our goal, the vision for our future is to really put ourselves out at a business. So, the relentless pursuit of reducing childhood disease, improving the treatment of childhood diseases, not just for the children who walk in the doors at CHOP, but for children around the world, because we're spreading these innovations everywhere through our publications and the information. So big picture, our vision is, continual breakthroughs, changing the course of pediatric disease. And I certainly won't realize it in my lifetime, but it means the pursuit of that is no less important. For us, that means several things. One is investing in our facilities and our equipment, which is quite expensive. And we have a new patient tower coming up. We have a new hospital in King of Prussia. We have yet another fourth research building that we're going to be building. So lots of investment in space that's really unique to allow these innovations to occur. But more important than that investment is the talent investment and being talent scouts. And I think our biggest challenge in the future is finding the best and brightest in certain areas, tapping them on their shoulder and telling them, you should come live in Philadelphia and work in Philadelphia, because it's not, most of this you can't do remotely. You have to be at the bench, in your lab and at the bedside. But this is a city and an ecosystem and a community that's worth joining. And we will bet on your ideas and invest in you. And there's so much competition for talent, and particularly in the area of pediatrics, lots of limitations. So I think that's going to be such a big challenge for us. And then finally, anyone who's in healthcare, we're seeing such big pivots depending on changes in federal and state administrations. And it sometimes causes whiplash because, this is covered now and this is not. And, being able to stay focused on, investing and understanding where your revenue is going to come from is challenging when you don't know. Almost half of our revenue comes from the government, and the government changes. So for example, like we rely a lot on federal funding for research. And that means that we have to rely on elected officials to understand why that's important and what does that really mean for society. And so those are the things that are always threatened and can change depending on who's in office, either at the state or the federal government.
Yeah, and I love that you mentioned kind of touting Philadelphia as a great place to come live and work, right? It's something we talk about a lot at NextHealth PHL, and Philadelphia continues to kind of climb the charts in terms of where folks working in the life and biosciences should come to be. I have a really hard question for you now, because I always like to close on a lighthearted note. And I won't give you something as hard as where is the best cheesesteak in Philadelphia, because we might be here for a really long time.
Oh, I can answer that, but
Really?
It's not Pat's or Gino's. I think
it's not Pat's or Gino's. I agree.
I think Jim's Steaks is the best.
Okay.
And when I saw during the pandemic they might close, I was like, oh no.
I know. Yeah, we've mourned a lot of kind of just fears of closures of different places. My favorite is D'Alessandro's.
Oh yeah, that's a good one too.
It's a good one, right? Long line, but it's a good one. But I guess if you could just share like your best place in Philly. What's your favorite place to go in the city?
I love Fiddler Square. It's close to I live in the city. I like just sitting. I love to walk up there and just watch all the families, like all the little kids playing in the park and sidewalk chalk and all that kind of stuff. And I think that's really nice. I also live on the Schuylkill River Park, and I get to watch a lot of people having fun. But sometimes I like to walk away from my neighborhood just a tad to enjoy that. But to see the diversity of our city in so many ways, and people having fun and enjoying themselves, and walking on the Schuylkill River Trail, and just seeing movie night and food trucks, and I feel like it is really undersold. I'm certainly am biased. I live and work in Philadelphia, and when I recruit people, I always try to give them, special tips about what makes it really great to be here.
Yeah, there you have it, folks. Diversity, innovation, breakthroughs, all happening here in the city. What a great conversation this has been. Thank you so much again, Madeline, for taking time to share with us all the exciting things coming up at Children's Hospital. Another thank you again to our sponsors, Independence Blue Cross, and thank you to you, all of our great readers and watchers and event attenders of NextHealth PHL. Look forward to seeing you next time.